Welcome to Practical Exercise Data Visualization, Example 1. Today I'll show you how to use AI tools to turn raw data into clear visuals. If you often have data in your work or studies but find it hard to visualize, this presentation is for you. You'll learn how to use AI tools to make your data clear and effective. Let me explain what we'll do in this exercise. Our goal is to show how to turn raw data into clear visuals using AI tools without needing special skills. We'll use a real-world example to make it easy to understand. 1. Introduction. Choose an example for data visualization, like an NIH R01 application. 2. Data preparation. Extract raw data from a relevant article that needs visualization. 3. Results. Visualize the extracted data using AI tools. 4. Conclusion. Compare the new visualization to the original figure. 1. Introduction. Choose an example for data visualization. First, let's pick a good example for this exercise. We need an example that serves a specific purpose. Since we are also looking at grant writing, it's helpful to choose an example related to that. As a public health student, an NIH R01 grant is a logical choice. So, we'll use an NIH R01 grant as our example. Next, we need a topic for the NIH R01 application. Since I study at NYU School of Global Public Health, we should choose a topic used in this school for an actual NIH R01 application. We found Dr. Corina Moucherel, a top faculty member who had a successful NIH R01 application on identifying modifiable multi-level factors associated with HPV vaccine uptake in Kenya and Malawi. This grant was so exceptional that it was converted to an R37 grant, which happens to less than 1% of R01 grants. This topic is perfect for our exercise. Now, we need to think about what kind of data visualization would support the application. It's important to show background information that highlights the need for more research. To do this, we'll explain and organize Dr. Moucherel's previous work. We chose an article with raw data to visualize cervical cancer prevention in Africa, a policy analysis. This article has valuable data and tricky visualizations that can't be easily done with Excel. 2. Data preparation. Extract raw data from a relevant article that needs visualization. We took data from Table 2 of the article. This table shows how comprehensive cervical cancer policies are in different African countries. The scores were based on primary prevention, HPV vaccine type or schedule, target age for HPV vaccination, where the vaccination happens, and education efforts. Secondary prevention, screening method, target age for routine screening schedule, lesion treatment method, lesion treatment protocol, and awareness-raising activities. Tertiary prevention, cancer treatment methods, and palliative care approach. Each policy element got 1 point, with total scores for each country ranging from 0 to 12. We put this data, especially the total scores, into an Excel spreadsheet. Here are the policy comprehensiveness scores for each country extracted from Table 2 in the article. Our goal is to create this map using these scores. 3. Results. Visualize the extracted data using AI tools. After consulting with ChatGPT, an AI language model, and Perplexity, a search engine using advanced AI, I chose Julius AI for data visualization. Both recommended Julius AI because it's great for creating detailed and customizable visual representations of data, especially for complex data sets. I also watched some YouTube videos about Julius AI and found it very useful. Using Julius AI, I created an editable map of Africa. Here are the detailed prompts I provided to ensure accurate visualization. Countries were color-coded based on their total values using a gradient of blue shades. Each country was labeled with its value, and countries with no values were displayed in white. The map included all 54 African countries, with special attention to the visibility of island nations. Additional non-African countries were included for context, and the map was zoomed to focus on Africa. To create an accurate and detailed map of Africa, we gave Julius AI specific instructions. Initial prompt, we asked Julius AI to generate an editable map of Africa where each country is color-coded based on the total values from our Excel sheet, using a gradient of blue shades. Countries with the same total value share the same color, ranging from 0 to 11. Key requirements. Each country should be labeled with its value, without decimals. Countries with no values, NA, should be displayed in white, without labels. Include all 54 African countries, making sure island nations like São Tomé and Príncipe, Seychelles, Cabo Verde, Comoros, and Mauritius are visible as dots or magnified if needed. Don't display country names. Use dashed lines for borders. Set the background color to white. Add the title FIG. 1. Cervical Cancer Policy Comprehensiveness Across Africa. Include nearby non-African countries for context, focusing on Africa. Refinement prompts. Add and color the island countries correctly. Adjust the island colors to match the legend. Magnify the dots of the island countries for better visibility. Zoom out a bit to include all the island countries. Color the countries with no values light gray without diagonal lines. Add any missing countries and color them light gray. Make sure neighboring countries aren't cut off. Add them and color them light gray if needed. After these refinements, we ended up with a detailed and informative map. 4. Conclusion. Compare the new visualization to the original figure. The final product was a detailed map titled FIG. 1. Cervical Cancer Policy Comprehensiveness Across Africa, showing the different levels of cervical cancer policy comprehensiveness. Comparing the map I created to the original one in the article shows how effective Julius AI is at accurately representing complex data. To recap, our goal was to show how to turn raw data into clear visuals using AI tools without needing special skills. We used a real-world example to make it easier to understand AI tools. We chose an NIH R01 application, took raw data from an article, and visualized it using AI tools. This exercise showed how effective AI is in improving data visualization for research. Thank you for watching. This exercise shows how AI tools and public health research work well together, helping us communicate important information effectively. Using AI tools in research and grant writing highlights the importance of accurate data visualization for sharing complex public health information.